Welcome back to our special show now. All your questions on coronavirus, any doubts that you have regarding the disease, do call in. We have doctors to answer all those queries for you. Doctors from across the country joining us. Dr. P.K. Kundu, diabetologist, head department of endocrine at the School of Tropical Medicine in Kolkata. Dr. Sachin Lakade, interventional cardiologist, joining us from Pune. And Dr. Kaaf Subramaniam, professor and head of the Department of Endocrinology, King George Hospital, Visakhapatnam. Thank you so much, doctors, for joining us this morning and taking all the questions that people have. But firstly, I'd like to ask you regarding, there's a lot of talk of people with underlying conditions and the sort of complications that can arise from coronavirus, especially with those type of people. What sort of issues are you seeing? Dr. Kundu, first to you.
Good morning, everybody.
Morning.
Practically, with the coronavirus infection, now it has been found that there may be 30% asymptomatic. But the subjects who have been suffering from SARS-CoV-2 virus infection, then they may have the mild symptoms or the severe symptoms with pneumonia or the critical illness with the acute respiratory distress syndrome and also the acute symptomatic respiratory syndrome with the multi-organ damage and multi-organ failure.
Right.
So,
all right. And Dr. Subramaniam, anything you'd like to add? What sort of, issues are you seeing right now with you? You must be having so many patients who have various other, problems, diabetes or hormone imbalance, and that can get severely complicated with coronavirus.
Yes, definitely. See, when you look at various options and various things which are present with this corona, see, a patient who has diabetes or heart disease or hormone problems like thyroid, and most important is steroid deficiency. So these are various problems which can be there to the patient. But the most important thing is the patients have to be careful. They should be maintaining distance with others because they are more prone for complications when they get corona.
Absolutely.
Because once they have diabetes, the glucose levels are very much important, and high glucose levels will make them more susceptible for complications. That is one. Likewise, those patients who are on steroids, steroids might be for some adrenal deficiency, or they might be using steroids for some other disease, for example, rheumatoid arthritis. So these patients are also more susceptible for complications. So these are the patients where they have to be careful. They should avoid contact with most of the other people, so that they have to maintain at least 3 to 4 feet distance, even in the household. That is what is more important, because household people are going out.
All right, that's an important point, yes, because everybody has
important.
members of their household who actually do go outside. I'm sorry, Dr. Lakade, will just come to you, and lots of questions and lots of callers already lined up. We have Priyanka calling from Delhi. Go ahead with your question, Priyanka.
Yeah, good morning. My name is Priyank. Hi.
Yes, sorry, Priyank.
So the thing is that I have a question. Like earlier, the guideline was that the mask is not necessary for the general population. It's only for the frontline workers who need the mask who are in contact with the suspected patients. Now the guidelines have completely changed. So I just want to know what prompted this change. Like earlier, it was said that it does not spread through air, but now everybody is saying the mask is necessary for everybody. So if you can kindly explain as to what prompted this change.
All right, this is a question many people have, and Dr. Lakade, to you, because when we first started reporting on coronavirus, we used to emphasize that doctors are saying everyone doesn't need to wear a mask, but now it's become compulsory in many of our cities.
Yeah, obviously the mask is the very important thing to stop the spread, to stop the chain of this coronavirus, because it's very highly contagious, especially from the aerosol. Whenever a person sneezes, a person breathes, the virus is spread in around the locality of the person. So it's very important to wear a mask. That's the mandatory. There are recommendations that you should use N95 mask, but which is right now the shortage of because of this shortage of this kind of mask. At least a surgical mask is if possible. If not, then the clothes, whatever household clothes, which has to be cleaned every day. And that's very mandatory that all persons should wear a mask, irrespective of the person going outside in this community.
Right.
That's very mandatory that you should wear a mask.
All right, Dr. Kundu, anything you'd like to add to this, especially given the change that has come about earlier? It wasn't compulsory, but now the thinking is that everybody should wear a mask because, as you were pointing out, asymptomatic people, they could also be spreading the disease.
As you have been seeing that the disease is spreading in the clusters, and also there are some hotspots, and so cut down the chain of the droplet infection, because it is the droplet from person to person, and so mask is needed. But the one-ply cotton mask is how much the effective, that is questionable, because I think that the synthetic mask like that of Tailid or Decron or the silk should be used, because they provide the electrostatic force on the surface, and that will kill the virus. So that's another thing. And when you have been using the mask, when you have been going outside of your home, also you should not touch the outside of the mask and dispose it and open the mask carefully as per the protocol.
All right.
And never touch the outer surface of the mask.
All right, so really change in behavior, and of course the touching of the face is something that's been emphasized from the start. One has to get out of that habit. We have a caller from Bengaluru, Bhagya. Go ahead with your question.
Yeah, good morning, doctor.
Good morning.
I'm Bhagya Sanket. My question is too simple. I'm 70 plus, I stay in Bengaluru, and I'm glued to my four walls since last 25 days, and I have not gone out. And I have not come in contact with anybody. I don't touch anything outside, only whatever it is inside the house. Now, it has become an obsession that going to the sink and washing my hands every half an hour or so. And I want to know, if I'm inside my house for so long, is it that necessary that I have to wash the hands every now and then?
All right, Dr. Subramaniam, go ahead.
This is a very important question. But one thing is that we should wash our hands with soap, and that too, you should wash the hands up to the elbows. That is important. And remember, you should not wash the hands so frequently, especially if you are a diabetic. You may get fungal infections in between the fingers. So please be careful, and washing the hands at least 5 to 8 times in a day would be sufficient, because there is a waking up time. That means you are washing the hands every 3 hours or so. That is more than adequate. You need not wash hands every half an hour or so, because see, this is becoming something psychological. So you need not do it. When you are staying in the home and you are not touching anything which is being brought from the outside, and it is okay if you wash your hands every 2 to 3 hours once. Please, this should be very,
I think people are now, it's been so hammered into us to keep washing your hands. People, you don't even realize, they just, I think every 20 minutes just happen to go to the bathroom and wash their hands. It's become sort of a habit with everyone.
Yes,
we have another caller from Srinagar, Junaid calling in. Go ahead with your question, Junaid.
Good morning.
Good morning.
Since there is no vaccine available for the treatment of this dreaded disease at present, and the treatment is based purely on assumptions and presumptions, and the doctors have been saying it is only the immune system of a patient which is the only source of fighting this disease. If a person, after being caught by the COVID-19 disease, gets treated or goes back to his home, if he catches the second wave of infection of the same disease, does his immune system will work in the same way as it responded in the first case of infection?
All right, Dr. Kundu, if you could take that question also. There's a lot of talk of, plasma from recovered patients now being used for some sort of treatment. So yes, the impact it has on the immune system and the possibility of getting an infection again.
Yes, first, for the washing of the hand, I should also emphasize that the finger rings and the ornaments which have been worn, which have also to be washed thoroughly with soap and water. And I think that the practice of washing hands with soap for 20 seconds be a good practice, and then it will be a very good habit even after the epidemic will over. And of the plasma, convalescent plasma that contains the IgM, and that is against the COVID-19, and so it can kill the coronavirus, but the convalescent serum is very less, and it is to be pooled for 5 to 8 subjects. So it is also very scarce in our country, and it is not possible to treat every patient. Only the critically ill patient can be given the convalescent plasma.
All right, doctor, but the question, that Junaid had regarding the immune system as well, Dr. Lakade, if you could also answer that regarding the impact on the immune system of the patient who may have recovered.
Yeah, it's like if the patient has one infection, there is very less likely that he will have reinfection. But there are few cases in the world where from China, the person has been infected. Once he has been infected, after 3 weeks, 4 weeks, patient has recurrence of infection. The test has come positive. The symptoms are there. But obviously with the immunity, development of immunity, the severity of disease would be definitely low as compared to this time to come. We are aware, we are not aware, it's only now 2.5 months to 3 months for this disease. So we cannot assure, but having the antibodies in your body is very important, because once it's for any disease, if you have immunity for any disease, the less likely that the severity of the disease or the form of disease will be less severe, or you might not have that severe symptoms, or you might not have the symptoms also in the future.
All right, we have another caller from Bengaluru. Niharika, go ahead.
My question is, I traveled back from US on 18th of March. I've never had any symptoms till then, and I've been in quarantine for 14 days. Now my question is, in case if I'm an asymptomatic carrier of virus, for how many days should I maintain distance from everyone?
Okay, Dr. Subramaniam?
Anybody who has returned, usually the incubation period is around 14 days to 21 days. So when this is the thing, everybody who returns are probably an asymptomatic carrier. They should be at least quarantined for 21 days. That would be okay. But already the government has decided to quarantine for 21 days, and a further 1 or 2 weeks would do, because it is not only whether you are a risk for other people, it is also that you may contact from other persons also. So as far as your question is concerned, at least a 21 days of isolation would do.
Okay, 21 days up. We have Pavan now calling from Delhi. Pavan, go ahead with your question.
Hi doctors, good morning. I'm Dr. Pavan. Actually, I just wanted to know, since it's getting hot in Delhi and elsewhere, is it okay to use air conditioners in the houses or the clinics or the shops?
All right, Dr. Kundu?
Yes, about the hot season, you can use the air conditioner, but do not go from the cold room to the hot area frequently, and stay inside, because the air conditioner is good for filtering the air. And I think that if you have the susceptible to cold, then better to avoid it, because any sneezing or running nose or any fever, it happens, but if it is not due to the coronavirus, it may be like the common flu or due to the common cold, and then it will be confused to you, and you will be panicky, and then that you should run to the doctors.
All right, a caller from Baramulla. We have Shafat Ahmed calling in, and he's a health worker. Go ahead with your question.
Good morning, ma'am.
Good morning.
And good morning to all panelists there. My question is that I am suffering from last year diabetes and hypertension. Plus, I have a hypoxia, but I have to attend my duties regularly. What sort of precautions I have to take more and more? I would like to know what are the guidelines for the health workers in these conditions. Thank you.
All right, Dr. Subramaniam, very important question, especially for people who are working in the field of health right now and are suffering from other, underlying conditions.
Yes, first thing is as far as health worker is concerned, first you have to be careful about your own precautions to prevent corona affecting you. That is wearing a mask. Now it is very clear that you should wear a N95 mask. Second thing is you have to protect your eyes also with goggles. So otherwise you should have a personal protective equipment whenever you are moving out and looking at the patients or even the suspects. That is important as far as a health worker is concerned. As far as the preventive therapy with hydroxychloroquine is concerned, there are very clear-cut guidelines for the health workers who are attending the patients. These are the two things. And the third thing comes, you are a diabetic, you are a hypertensive, and he said there is some amount of problem with hypoxia. A diabetic, the most important thing is the diet, and with these conditions, probably the salads and vegetables may not be easily available. In that situation, you prefer eggs which can be taken, and the carbohydrate should be moderate. That is one thing. Second thing is when you are not able to go out, then you should be doing exercise in the house. There are so many apps, so many fitness things are available. So you should be doing it in the house itself. These are the two things you should follow. And third thing is the medicines. Medicines you should always have adequate supply. In these difficult times, it is prudent to have a medical deposit for about 2 months. That is good as far as health is concerned. As far as hypoxia is concerned, probably I don't know whether you are on PEEP or sometimes you are on assisted ventilation with oxygen. I don't know whether you have that type of thing or not. If you have that, you should be having that machine in house and you should be having assisted ventilation. So these are the things, various things which are to be careful. But you are asthmatic, then things are entirely different because asthmatics are more prone for respiratory complications in this situation. So probably if you are asthmatic also, probably you should ask the administration to relieve you of your healthcare worker duties. That is important.
Right. Given that he already has these underlying conditions, that he's more obviously vulnerable.
Comorbidities. So asthma, but only diabetes and hypertension less than 50 years, you need not worry, you can as well do the work. There is no problem.
All right, thank you so much for that, Doctor. We have a caller, Shankar, calling from Madurai. Go ahead with your question, Shankar.
Good morning, all. My question is regarding the groceries we purchase. Yes. Good morning, all.
Yes, go ahead.
Good morning. Please carry on.
Yeah. See, the groceries we get supplied to the home, it is delivered home usually in cardboard boxes, but sometimes it comes in gunny bags which we find sanitization is quite difficult. So as a valid safety measure, is it enough that we use it after 24 hours after it is delivered? So that
All right, Dr. Kundu, to you, I think we get this question very often and people are very wary of things that they buy and, bring back to the house. So what sort of precautions can they take?
On the fomites, the virus can survive even 72 hours to 96 hours. So whenever it has been supplied, there are many hands which have been touching it and we don't know that whether there is subjects who have been dealing with this package have been suffering from the disease. So it is better, not only the 24 hours, it is better to put the gloves and then take the groceries inside from it and dispose it in a very close container and dispose it in a safety place. Otherwise, also the vegetables and others, what you have to purchase from the market, you have to wash it with soap and water at least for more than 20 seconds. And also I recommend that the raw meat, raw fish or the raw animal organs or the raw milk should be avoided to take in this situation. Always the good sanitary practice and good cooking habit will kill the virus because we have been cooking at a high temperature and that will kill the virus.
All right, so we have time for just one last question. We have a caller from Guntur, Srinivas. Srinivas, go ahead with your question.
Yeah, ma'am. Good morning, ma'am.
Good morning.
Yeah, ma'am. Regarding, I'm working in a pharmaceutical company, ma'am. I'm covering almost 5 to 6 districts in a state. So after this lockdown, after reopen this organization and field force, ma'am, and may I know the precautionary measurements to meet ICPs and transportation and hotel this thing, ma'am. I need your precautionary methods for this one.
Because you need to travel still.
Yeah, we need to
All right,
travel,
Dr. Lakare, any what could you tell him with Srinivas? He still has to travel. He works for a pharma company, very important at this point.
Yeah, he's working in pharmaceutical company. It's try to be at home, try to be avoiding going outside, because it's ultimately breaking the chain. So what my suggestion would be there for you, or in general people who want who have compulsion to go outside, use mask properly. Every time you step out of home, use mask. It has been made compulsory and that should be followed. Stay away for at least 1 meter distance, that's 3 feet from the person to person. Avoid gatherings so that the transmission of the disease is least. Use hand sanitizer frequently if possible, by soap and water. You should wash your hands whenever you come back to home. That's another risk. You will have your family members getting infected. Wash your clothes properly. Get bath every time you come from outside. That's the way you can prevent your family also from getting the disease. And there are nothing specific rather than if you can do your work from home, you can make the calls from the from home. That would be the greater thing. If you have in your possible this thing, you can request your company, you can request your boss. I can understand there are limitations. You cannot do everything, all work from home. So that's very important. Minimize your contact with the people and the surrounding.
All right. Well, thank you so much, doctors, for joining us. Dr. Kundu, Dr. Lakare and Dr. Subramaniam for taking out time and answering all those questions that our callers had. And do remember to call in with your queries every day. We have the show especially for you. Thanks so much for watching. Goodbye.